I would like to begin by defining aphasia and auditory comprehension. Aphasia is an acquired neurogenic language-based disorder caused by an injury to the brain. There are many different types of aphasia, and I will explain a few types in depth later in this presentation. The types that I will explain are affected by poor auditory comprehension. Auditory comprehension is the ability to understand what is heard and attach meaning to it. This includes not just speech, but also intonation, pauses, and rhythms of speech that affect its meaning. Auditory comprehension deficits in those with aphasia is not deafness. They can hear everything that is said. They just might not be able to recognize the phoneme, the word, the phrase. They may not be able to keep up with the rate of speech someone is using. They may not understand how the intonation is working with the phrase to deliver the message. This is not a physical problem that can be fixed with surgery. It is damage to parts of the brain that help us understand spoken language that causes these auditory comprehension deficits. Auditory comprehension can be intact in many types of aphasia, but the majority of people with aphasia do have a difficulty following a conversation and may need you to repeat things more than once or use simpler syntax or vocabulary to help them better understand you. The aphasias in which auditory comprehension is most affected are Wernicke's, global, and transcortical. Wernicke's aphasia is a fluent aphasia characterized by difficulty in understanding language. The damage is to the posterior portion of the superior temporal gyrus of the dominant hemisphere, the auditory association area or Wernicke's area in the sylvian fissure. Comprehension of language is poor, especially early after onset. Some patients do not understand any spoken language at all. Some only understand specific words, and some have difficulty discriminating between phonemes. The difficulty in understanding language is not just auditory, but also visual written language. A prominent feature of Wernicke's aphasia is agnosionosia, meaning that patients are not aware of the language deficits they have. This makes progress very hard as the patients cannot understand why they are given strategies to improve their speech when they don't see that there's a problem with their speech. Global aphasia is a severe impairment of receptive and expressive language. Damage is usually associated with a large lesion in the perisylvian area. Comprehension of language is usually better than their expressive language. Nonverbal comprehension is also better understood than auditory. The individuals with global aphasia are usually mute or only speak a few words repetitively. These few words are often explicitives. Often body language or paralinguistic features can give away what you are saying to someone with global aphasia. So sometimes you may think that they're understanding what you're saying, but really your body language, facial expressions, gestures are doing the communication more than the words you are saying are. There are 3 types of transcortical aphasia, but only sensory and mixed transcortical aphasia have poor auditory comprehension. First, sensory transcortical aphasia is fluent. Many people with sensory transcortical aphasia have paraphasia, which is semantic and neurological substitutions. Their comprehension is poor, but their repetition is intact. The site of lesion is controversial, but typically is in the temporal or parietal border zone. Mixed transcortical aphasia is rare and non-fluent. Their articulation is good, but the expressive language is not intact, which is why it's still considered non-fluent. There is little to no comprehension of spoken language. It is disordered in most areas of language, but repetition is usually intact. Lesions typically are in the associate cortex area known as the watershed area. The quality of life of someone with auditory comprehension deficits can be isolating and lonely. Imagine your whole life you've been well articulate and understood everything that went on around you. You have a spouse, kids, and grandkids. Now you have aphasia and you cannot understand what they are saying to you. You are constantly lost in conversation, and don't understand the words that seem familiar but have no meaning to you. And even though you know exactly what you are saying to your family members, they don't seem to understand you. You can't understand why, because you aren't aware of your deficits. This can be very socially isolating. People with this disability can become mutes as they associate talking with frustration and feel that they are not understood. Your close friends may not come around anymore and leave you out of activities you used to do together. This can cause depression and decreased self-esteem. People with aphasia may not be able to participate in hobbies that they used to do or have the career that they used to have. This can make them feel less valued. Imagine that you cooked Thanksgiving dinner for your family every year, and this year you go to cook and you can't understand the directions, you can't understand what people are telling you they want to eat, and so in return, it's really hard for you to understand what they want you to cook for Thanksgiving this year. That can make you feel less valued and lead to isolating yourself because you feel like you aren't as valuable as you used to be, or it can lead to depression. According to Cruz, Worrell, and Hickson, on average, patients with aphasia have 9 fewer social contacts or friend relationships than their non-aphasic peers, and 3 fewer social activities or leisure activities than their non-aphasic peers. People with aphasia in this study expressed a desire to increase the social activities in their lives. This shows that even though some with aphasia aren't aware of their deficits, they are aware that their life has changed. This can be frustrating to not fully understand why your old friends are present in your life or why people don't understand you. And being aware of that, but not aware of your deficits, can cause even more frustration on top of the frustration. So the quality of life for someone with aphasia can cause a lot of negative feelings towards themselves and others, decreased self-esteem, social isolation, lead to unemployment, and low levels of leisure and social activities. To better understand someone with Wernicke's aphasia with auditory comprehension deficits, I looked up a case study. This case study is about a 65-year-old man who doesn't understand why people couldn't understand him. He also couldn't participate in his favorite hobbies. In a situation with the police, they were unable to understand him, and because of his agnosia, he did not understand why the police were not understanding him. And also because of his auditory comprehension deficits, he was not able to understand why the police were yelling at him or talking to him and what they were saying. So the police ended up thinking he was dangerous and put him in a psychiatric facility. Lastly, his wife is frustrated that they could no longer communicate. In Phil's treatment with an SLP, there was a lot of discussion about the incident with the police. And people with aphasia often talking through a situation in a way that they can understand, using familiar words that they understand, or role play in a situation can help them understand why something went wrong. And so that was part of Phil's treatment. And strategies were taught to both him and his wife to help each other learn to communicate in their new reality of Phil having aphasia. So while the quality of life for someone with aphasia can cause depression or isolation, treatment with an SLP to help improve auditory comprehension and other communication skills can help improve quality of life. When someone has a brain injury, usually they are not the only person affected by the brain injury. Yes, they are the only person whose brain is injured, but their ailment or disorders that are caused by their brain injury affect others around them. Their caregivers may become frustrated that their loved one with aphasia cannot understand them. Their caregivers may have to use compensatory strategies to best communicate with them, and often people with aphasia take out their frustration on their communicative partners. So the caregiver may feel like their loved one with aphasia is frustrated with them, and that may be the case, but the caregiver and the person with aphasia will have to work together to use strategies to help them communicate. Simple things you can do to help someone with aphasia understand you better is slowing your rate of speech. You can do this by elongating vowels, pausing between words and phrases. You can also use simple syntax or shorten a story by deciding which details are most important for the person with aphasia to understand. Repetitions in conversation are also helpful, as a person with aphasia may not tell you that they don't understand. Using visuals that relate to your topic can help a person with aphasia understand the topic. If they don't understand the word you are using for it, for example, if you are talking about their granddaughter, you can hold up a picture and point to the granddaughter when you say her name. This will help them associate their name with the granddaughter. Using words you know are familiar to a person with aphasia can increase their chances of successfully understanding you. Using emotion can help lead the person to aphasia to the correct emotional response. Lastly, paralinguistics, like facial expressions and gestures, can help them understand the overall meaning of the message. Often, our society thinks our communication skills show our intelligence. This is not the case for people with communication disorders. Like someone that has aphasia and auditory comprehension deficits, someone might think, oh, they're not understanding me, they're not intelligent. It is important for us to understand that someone with auditory comprehension deficits and aphasia is not any less intelligent than they were before their stroke. Their stroke may have led to some other deficits, but just because they have auditory comprehension deficits does not mean that they're not intelligent. They still understand the things that they understood before. Their auditory comprehension is just what's wrong in this situation. SLPs use evidence-based practices to help treat their patients with auditory comprehension deficits. So, to better prepare myself as a future SLP, I looked up 2 studies that may help me in my future career and also help me understand how to teach family members and caretakers to best communicate with their loved one that has comprehension deficits. The first study was called Effects of Slowed Speech on Auditory Comprehension and Aphasia. 3 specific steps were taken to slow speech. The first was to increase auditory perception by increasing the duration of the vowel sounds in each word. The second was to help word recognition and semantic analysis by adding silent pauses between words. And the third was to aid syntactic analysis by adding silent pauses at phrase boundaries. The results of the study showed that slowed speech and simple syntax improved comprehension specifically in aphasics with Wernicke's aphasia. The second study was paralinguistic aspect of auditory comprehension and aphasia. The finding in this study was that the emotional content of sentences increased responsiveness, which provides support for the prediction that emotional stimuli has an impact on the reception of spoken language in people with aphasia. Speech-language pathologists are more than just clinicians. They are also advocates for their patients and can help counsel families when it comes to communication-related things. According to ASHA, consulting with other professionals to facilitate program development and to provide supervision, evaluation, and expert testimony are appropriate. Being an integral member of a collaborative team could be with physicians, neuropsychologists, occupational therapists, and physical therapists. It's our job as an SLP to consult with other professionals to provide the best care to help our clients and patients improve. So, as a speech-language pathologist, some things you can do for someone with auditory comprehension deficits with their aphasia is teaching compensatory strategies to the person with aphasia, but also teaching those strategies to their family, so their family can learn to communicate with them in a way that they'll understand it, and so the person with aphasia can learn to communicate in a way that their family will understand. We can also support the family emotionally and give them resources to help them understand what's going on with their family member that has aphasia, but also to understand that they're not alone. So this can be provided through showing them support groups or written resources like blogs, professional journals, and other like Facebook groups that might be more relatable to someone than the professional journals. People with aphasia and auditory comprehension deficits still have the same desires as they did before their stroke or brain injury. They still want to fit in with their peers, they still want to communicate with their family, and they still want some of the same things and goals that they did before their brain injury. Quality of life can be frustrating, but can improve with the help of speech-language pathologists and other professionals. Their auditory comprehension does not define them and is important as an SLP to remind our patients of that. I don't know how to stop it. It's like it forgets that it's